interview to have a look at the Joseph and France General Hospital. We have been talking a lot in terms of preparation to fight the COVID-19. I have come to see for myself, I need the evidence, and of course you're here to show me what do we have at the Joseph and France General Hospital so that in case we have emergencies and so on with respect to the COVID-19 that we are adequately prepared.
This is one of our portable X-ray machines, so persons who come with cough or flu-like illnesses, we don't necessarily have to take them across to the X-ray department to have the X-ray. This machine can be pushed inside the emergency room and have the X-rays done. So someone just recently had an X-ray done. Welcome inside. So we are now in the emergency room proper, and I'm going to introduce you to some of our staff members here.
So welcome to our emergency room. So during the last couple of weeks, what we've done is make a division here. So this is like a sheetrock, separation there. So we have it divided into two emergency rooms. We have emergency room A and we have emergency room B. So on the A side, you can see some of our staff members there through the glass. Yes, that side. That side is where we deal with the viral infection. Anybody who comes in with flu-like symptoms, they're seen on that side by our staff. And in this emergency room B, where we see our regular patients, our diabetics, our acute surgical problems. So this is how we organize it for this period of time. I wish you could have spoken to one of the staff on that side because they're the ones who are actually dealing with the viral infection. You can see they're wearing the PPE equipment there, the personal equipment there. We have Dr. Sebastian who's waving at you at this point. I don't know.
But you can see he's dressed in full PPE. He has on his cap, he has on the mask, face shield, he has his gloves, gown, etc. As I said in previous interviews, we have 15 rooms here where we'll be able to host these persons. These are single rooms, so we can properly isolate these persons. So let's take a look. In the United States, the population is about 329 million, and on average per state, they have about 19.5 ventilators per 100,000 population. Here in St. Kitts, we have 11 ventilators for a population of 40,000 persons, which makes it about 30 ventilators per 100,000, which means that we are ahead of the game. And as yet, you can see, we have no patient on the bed, no patient on the ventilator, and we have 10 ventilators here, and 3 in the intensive care unit. 4, sorry.
We would like to keep it that way.
Yes.
No patients on the bed.
Okay, this is a room that can facilitate any patient that needs to be ventilated, because at any given time we have the chances that we would have more than one patient that would need required ventilation services. So it's a duplicate of the original room that Dr. Wilkinson would have explained to you, so we lessen the chances of cross-contamination from leaving one room to the other room.
Okay, we've just had a tour of the Joseph and France General Hospital. We've had 2 interviews before with Dr. Cameron Wilkinson, Medical Chief of Staff at JNF General Hospital, and Dr. Hazel, who is our Chief Medical Officer. They have shown us today how prepared the hospital is in the case of any eventuality with COVID-19. Of course, we saw the emergency room, the physical changes that have been made to the emergency room to create 2 separate areas, staff and equipment, so that there is complete separation of the patients to prevent crisis infection. We also saw 10 rooms where there are ventilators for anyone who will basically be suffering from severe respiratory failure. Today, we are going to continue this conversation in terms of the COVID-19 pandemic that continues to create a lot of disturbance all around the world, and to continue to show our citizens and residents how prepared the medical fraternity is in St. Kitts and Nevis to deal with this pandemic. So, the World Health Organization, WHO, described 4 transmission scenarios for countries affected with COVID-19. Can you explain what are these 4 scenarios and what level is St. Kitts and Nevis at in these 4 scenarios?
Okay, I'll start off first. The World Health Organization described 4 scenarios, as you said, for countries that are affected or will be affected with COVID-19. And the 4 scenarios are: 1, countries with no cases at all; 2, countries with 1 or more cases that were imported or had some local sporadic cases; 3, countries that are experiencing cases in clusters, whether they are clusters in time or in a geographic location or from a common exposure; and lastly, countries that are experiencing large outbreaks due to local transmission, what is called community transmission. So those are the 4 scenarios or the 4 levels that the World Health Organization has described.
Right. Now, how does our strategic preparedness and response plan to COVID-19 address where we are in St. Kitts and Nevis in terms of those 4 scenarios? Dr. Laws.
Okay, so Mr. Williams, I think I should really underscore at this point that the Federation of St. Kitts and Nevis was at scenario 1 for a very long time. Based on all the Caribbean countries, the English-speaking Caribbean countries, St. Kitts and Nevis was the second to last such territory to have reported 1 case of COVID-19. And I want us to remember that we are one of the tiniest nations, and we were able to successfully keep the virus at bay for the longest period of time possible. And we were able to achieve that by 1, preparing early. We started preparing from as early as January of this year. And then we employed timely interventions at our ports. In other words, we strengthened our surveillance at our ports. And thirdly, what we did is we looked at the countries who were farther ahead on the disease spectrum, and we researched the best practices, and we noted the lessons they have learned, and we have chosen to adopt some here in the Federation.
I also want to support what the CMO just said in terms of us being at level 2, because if you think about the different scenarios that I described, we are not at level 3 because we don't have any significant clusters of cases. We're not at level 4 because we don't have any widespread community outbreak. We are at the stage now where we have a few imported cases and some sporadic cases, so that puts us at level 2.
I want to add, based on the information we have to date, these sporadic cases appear to be import related. They appear to be import related. At present, our team, our public health practitioners, are conducting investigation of these import related cases.
So the last point I want to make here then is that with our things that we have in place, where we have the lockdown, our enforcement of the social distancing, our rapid identification, quarantine and isolation of suspect cases or persons who are confirmed to have the disease, we are hoping to level the curve to decrease the transmission and hopefully at some point in time make our nation COVID-free, and that's our ultimate aim.
You asked Mr. Williams about our strategic preparedness. I want to state that the Ministry of Health strategy at this time is to slow down the increase in the number of cases as much as possible, and we want to reduce the intensity of the outbreak. We aim to do this by 1, testing and identifying all cases in a timely manner, and these cases will all be isolated and appropriately managed, especially the seriously ill. We want to interrupt the transmission of the virus and the development of clusters by aggressive contact tracing. All the contacts of the of the cases will be automatically placed in quarantine and tested. And in order to delay the spread of the virus, we are using the social distancing measures we have employed. For example, we are presently on a 24-hour lockdown. And then we want to minimize the impact of the outbreak on our health system, our social services, and the economic activity of the Federation. We aim to protect lives and livelihoods.
And just to elaborate more on what she said, our approach is what's called a whole of society coordination approach, where we are seeking the support from all sectors of society, be it health, transport, travel, finance, security. And we saw from the meeting you had yesterday that there are a number of corporate businesses and individual persons who are coming on board, and this is what we are hoping to do, because we can't fight this epidemic or pandemic by ourselves. And we attempt to sensitize the public to their active role in our response. And we speak about social responsibility because that's an important part in the fight against this. For example, on Wednesday, when the supermarkets are open, we expect persons to exercise social responsibility as it relates to their distancing outside the supermarket. I can tell you that earlier this week I was in the supermarket, and I was actually shocked to see that there were some persons who, once they got inside, they forgot about all the other persons who were outside there waiting. So there were some persons who were in there lazing around on their phones, etc. When you get in that supermarket, you need to know that you're on a time clock. There are other persons who are in the sun outside there waiting, and you must exercise some responsibility in terms of moving along and getting things going. But we are continually assessing the effectiveness of what we have done, and making sure that we learn from any mistakes that might have been made by other countries to see how we can improve what we have been doing. We also continually keep abreast as to what's happening on the market as it relates to new products, be it in diagnostic, therapeutics, or vaccines. And so we are forever on the draft board making sure that we are abreast in terms of fighting this disease.
Now, Dr. Laws, there has been a lot been said in terms of testing and testing capabilities, and if we have enough test kits and all of that sort of thing. Can you address that in some depth? Because there are some people who are saying, oh, we only have these number of cases because we are not testing enough, and that sort of comment that is being made.
Okay, so thank you very much, Mr. Williams, for this question. I want to begin by saying that this is a pandemic, and this outbreak has impacted so many countries worldwide. And so it's understandable that the demand for testing is higher than the actual reality and the capability to do so. Now, the RNA-based diagnostic tests, the RT, the real-time PCR, polymerase chain reaction test, is done at the Next Generation lab here locally, and it's also carried out at the Caribbean Public Health Agency Medical Laboratory in Trinidad. So now these tests are regarded, this test, the RT-PCR test, is regarded as the gold standard, and it looks for the presence of viral genes in a nose or throat swab. And this suggests, or this indicates, that there is an active infection in the individual. And as I said before, the RT-PCR test should be used to confirm the diagnosis of COVID-19. Now, in the press, we see a lot of articles, and a lot is being said about an expanding number of antibody test kits that are available. Now, these test kits can detect active infections, but more importantly, they can tell you whether an individual has been infected in the past. All right, so there is a time factor. All right, so in other words, if you use a test kit too early, you may get a negative, but in fact, the individual has not mounted the response as yet, so it's a false negative. Now, antibodies can appear in the blood 1 to 3 weeks after infection. What does that really mean? Now, if the virus enters my body, my immune system mounts a response, and my body generates antibodies. The IgM antibodies appears 3 to 5 days after the virus would have entered my body. And the IgG antibodies appear 3 to 5 weeks after the virus would have entered my body. And so there's a time factor in terms of the utility of these antibody test kits. These are the antibodies that are identified from a small blood sample obtained through a finger stick in the rapid antibody test.
It is therefore important for us to stress here then that negative test with the rapid antibody test does not necessarily rule out COVID-19 infection, because the virus could have been multiplying in the nostrils of the person before they mounted an immune response. Therefore, if someone has a negative antibody test, it needs to be confirmed with the regular antigen test that she spoke about. Now, what is the usefulness then of this rapid antibody test? Because as you said, you've been hearing a lot about it, and we actually have been looking at this for the past several weeks. As I said earlier, we are keeping abreast as to any latest development as it relates to therapeutics, vaccine testing, etc. And we have been looking at this because earlier there were a number of tests that were coming out of China. Some of them have been proven to be unreliable, and we want to make sure that whatever test we use here, we can swear to the reliability of it. Okay. Now, what these tests do, if, for example, one is to do a rapid antibody test, it can identify persons who were not known to be infected, either because they never developed symptoms or they had symptoms that were never correctly diagnosed. Therefore, it can be used to find out those persons who were silently infected. It also helps us from a public standpoint to know the amount of persons in the community who would have been infected, and this will tell us more as it relates to herd immunity. Because if, for example, we were to start doing widespread antibody tests and we found that a significant portion of the population has IgG antibodies to this test, it meant that the virus would have silently infected a number of persons, and now we have a significant number of persons who are immune, and therefore we have herd immunity. Now, this test will ultimately tell us whether or not we can get back to normal. And that's one of the reasons why we at the Ministry of Health, we actually look at this. I think that we'll be starting some testing, Hazel?
Yes, today.
Today?
Today, yeah.
Right, now in terms of testing, we cannot test everybody. As we've said before, sometimes there's a shortage of test kits. Even in very developed countries like the United States and some countries in Europe and so on, they're having a struggle in terms of testing. How do we as a small country prioritize who gets tested and who doesn't?
Okay, so again, Mr. Williams, this is a very good question. And I would begin by answering that we just cannot test everybody who just willy-nilly come up and say, hey, I need to be tested for COVID-19. And so really we are prioritizing individuals who have symptoms and who provide us with a travel history from a country who have had an outbreak, COVID-19 outbreak, or provide us with a history that they may have come in contact with an individual who has came into country from a destination where there is COVID-19 outbreak. And then we are also prioritizing the contacts of the cases. So if you're a close contact of a diagnosed case and you develop symptoms, you will be tested. And then there are some contacts who are symptom-free, but they would have given us a history that they had close interaction with a case. They too are prioritized. And right now we only have a few imported cases and some sporadic cases. But as the infection progresses, the outbreak progresses, and we get into the phase of community transmission, we are going to have to use guidelines to help us in terms of prioritizing. And so what the protocols tell us is that in the setting of limited resources and in areas with community transmission, the guidelines for prioritization for testing are: 1, people who are at risk of developing severe disease and vulnerable populations who will require hospitalization and advanced care for COVID-19. Health workers, regardless of whether they are a contact or a confirmed case, because it goes without saying, we need to protect our frontline health workers and reduce the risk of nosocomial transmission. Thirdly, the first symptomatic individuals in a closed long-term care facility setting, for example, nursing homes, prisons, even hospitals and schools, because we have to quickly identify outbreaks in those high-risk settings. And fourthly, all other individuals with symptoms related to the closed settings may be considered probable cases and isolated without additional testing if testing capacity is limited.
So, Dr. Laws, before we go on then, because what you're saying, it is easy for us to say test, 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 but we cannot test the entire population. And even if you were to test the entire population, it might give us a false sense of security, because you would have to start testing again, because a negative test is not permanent. But what we are looking at also is the clinical outcome, because as I said, we are at the stage now where we are looking for the surge. Our first diagnosed case was on the 25th of last month, and I think that the first time the individuals came into the country was on the 18th
of March.
Therefore, if we were to have a significant surge from those persons, presumably if they had caused widespread spread of this virus in our society, we should have been starting to see a significant number of persons presenting with clinical symptoms here at the hospital. And although we have the emergency room set up to deal with persons with flu-like illnesses, on average, we see persons, at least 2 to 3 persons per 24 hours, and none of them with serious symptoms and not necessarily related to COVID-19. And you can see as yet we have a ward here that is empty, so we have no admissions here, we have no persons on the ventilator. If you put this against the backdrop of what's happening in the United States, it will tell you that we're ahead of the game and we're flattening our curve. And so that is good news for us for the time being.
Right. One of the questions that has been asked Dr. Wilkinson and Dr. Laws is that the real danger lies with the asymptomatic, people who have COVID-19 and are asymptomatic, because they can be spreading the virus, not even knowing it.
Well, that is so. But if they're spreading the virus, then we expect to see some increase in the number of symptomatic patients also, and we're not seeing that increase, which means then that we somehow have a cap on things right now.
Now, I've noticed that we have no recoveries, at least yet, from COVID-19. Sometimes when I look at the statistics worldwide, I see there are people who are recovering. In terms of the number of confirmed cases that they have, the number of deaths, of course we have no deaths, and the number of recovered cases. We have 11 confirmed cases of COVID-19. There are 0 deaths, there are 0 people who have recovered. How long does it take to recover? Yes. And how do you know that one has actually recovered?
Okay, well, let me speak about how long it takes for someone to recover first, because that might explain why we haven't deemed anyone completely recovered as yet. And the best information we have is from a World Health Organization study that was done in China, where they examined 55 persons who were infected with the COVID. And on average, they found that persons who had mild symptoms from the onset to the time when their symptoms resolved, they took about 2 weeks to recover. And for those who were more seriously ill, they took as long as 3 to 6 weeks to recover.
I want to add, Mr. Williams, that a small study coming out of China also suggests that the new coronavirus can persist in the body for at least 2 weeks after the symptoms have subsided and cleared up. And that's interesting.
So even after the symptoms are gone, the virus still remains in the body.
But this sort of persistence is not unusual for viruses of this nature. And thankfully, the patients, however, tend not to be, are not usually very contagious in this post-symptom period. Now, the viruses that tend to hang around in individual systems also tend to be the viruses that helps those individuals' immune system to develop immunity against the illness. So there is a positive, and this is a blessing in disguise, really.
Right. So how do you know actually when someone has been recovered? Do you have to retest them?
Yes.
Mhm.
In order to be considered completely recovered, one of two things must happen. Either you must have 2 negative swabs separated by 24 hours apart, or the person must have 72 hours where they were symptom-free of respiratory illnesses and fever, etc. Because it's important for you to know that while the person is mounting their immune response, the viral load can decrease significantly such that it is not found on the regular test. So someone can test negative, but they may still have, as Dr. Laws pointed out, small levels of a virus within their system. And although they may not be highly contagious, just to be on the safe side, we will still keep these persons isolated so that they don't spread. Therefore, it usually takes a span of about 15 to 21 days after someone tests negative before they're released freely and say that they're completely recovered.
I want to say, add Mr. Williams, that in other words, recovery from COVID-19 infection does not mean that one is completely free of the virus, COVID-19 virus. And I want to underscore that. And so it is advisable that a patient who would have been diagnosed with COVID-19 and who has recovered, that individual must still continue to be in isolation for 4 to 5 days based on CDC guidelines, and up to 14 days based on the Pan American Health Organization guidelines. And so I need to find out what's the consensus on that in terms of the time period for which somebody who would have recovered, what's the time period they need to remain in isolation post-recovery to ensure that they're totally virus-free and ready to mingle and go back into society freely.
So there are good news from our perspective here in our little federation. The number of positive cases that we have, we've been following them, and clinically they're all improving. Some of them have no symptoms at all, but if you see from the time when we said we made our first diagnosis, we haven't really gone 21, 30 days as yet. And so out of an abundance of caution, we're still keeping an eye on these persons before we deem that they have completely recovered, but they're all recovering and doing well.
Now, when someone has been deemed completely recovered, can they be reinfected?
And you see, a very good question. And I think that's why the protocol and the guidelines are telling us that individuals who have recovered, they still need to remain in isolation and not resume their normal activities for a period of time, either 5 to 7 or 14 days. And I think that's out of an abundance of precaution such that they do not become ill again. Because the literature tells us that there are some individuals in China, that was their experience. There was one lady in particular, she was admitted, tested, treated in hospital, so-called recovered, discharged, came back in, tested positive again. And so I think that's the genesis behind this additional guideline.
And just to emphasize that point, because generally speaking, when one gets infected with a virus and they develop immunity, the immunity can be lifelong or for a significant period of time. Now, the few cases in the literature where we speak about some persons appear to be reinfected, these actually could have been persons where they mounted an immune response, their viral load dropped significantly so that they tested negative, but they still needed to be observed. And if for any reason at all their immune system became compromised, then the virus can start multiplying again. Okay? So one always have to keep a watchful eye, continue doing the things to keep yourself healthy.
Now, after you have been deemed recovered, can you still spread? I suppose you answered.
Yes.
No, you can't at that point in time. Once you're completely recovered.
Once you're completely recovered and would have completed the additional days in isolation, based on the literature, your viral load would have been, negligible, And so, you know, the risk of spreading would be minimal.
Because that is how we're going to get our country back to normal.
Yes.
If, for example, we continue our observation period of these persons who were infected, and after 21 days they're deemed recovered, we don't have any evidence of any viral multiplication within them, we don't have any evidence of spread, then we can start opening back our country, because we're not going to stay locked down forever. The aim is to contain this virus and then get back to some semblance of normalcy.
Now, there seems to be a lot of concern in terms of people in quarantine and how these people are being policed while they're in quarantine and when they get out of quarantine. Now, what is the quarantine period? And before someone can be released from quarantine, what has to happen? What is the protocol before they can be released from quarantine?
Okay, another very good question, Mr. Williams. And so, majority of the individuals who are in quarantine, they were really contacts of confirmed cases, or some of them would have returned to come into the Federation from a country where there's an outbreak. And so really you are observing them for the onset of COVID-19 symptoms. And so they would have to remain in quarantine for a minimum of 14 days, which is the established incubation period. However, based on the evidence and the science, the incubation period, it's a range, and it can be as long as 24 days. And so that's why we are saying that individuals should remain in quarantine for a minimum of 14 days. And then what we have in place here, our protocol says that that individual has to be evaluated by the district medical officer. We now have developed an instrument for that. And so there are a series of questions and health check. And then you would be released from quarantine with a proviso. What we are telling individuals, even though you would have been released from quarantine, you still need to continue observing yourself in terms of the onset of any symptoms. And so that's where we are at right now.
Now, there's a lot of, things floating around on social media that there are various treatments for COVID-19. People are saying all kinds of things. There's a cure, there's this, there is that. Even in the United States, Mr. Trump is proposing an anti-malarial drug for helping with the cure of COVID-19. Is there any cure, or is there any medicine that you would propose at this time in terms of helping with the cure of the COVID-19 disease?
Well, we are looking at all the information, okay, and we are taking all of these pharmaceuticals into consideration, be it the anti-malarial drug, the interferon therapy, and we are looking at the scientific data. There are some studies that say they help, there are some studies that say they don't, but we also have to balance their use against their side effects, and we will make that determination on an individual basis. I can tell you, however, that we have stocked up, okay, in terms of having Tamiflu, we are getting the interferon therapy, the anti-malarial drugs, etc., hydroxychloroquine. So yes, we have all the armamentarium here, and we'll determine on a case-by-case basis if we have to use them. But from the looks of things, I hope that
all right, I would like to add that I have been working very closely with our internal medicine specialist, Dr. Bishara Siheli, and he's combing the literature in terms of what's the science behind the usage of these drugs. And I'm following his recommendation. And so, as Dr. Wilkinson said, we have ordered some of these drugs. The latest one on the block is vitamin C, intravenous vitamin C. And so he's looking at the randomized controlled trials and the results in order to advise me if, hey, I need to add intravenous vitamin C to the list. So we are continuously monitoring this outbreak and monitoring the literature, and we are guided by same.
Some people are proposing home remedies. For example, garlic and turmeric and these sort of things that people will normally take with the common flu. But this is much worse than the common flu.
Well, one of the approaches is symptomatic treatment. And if you think that sucking on a piece of ice makes you feel better when you have a fever, then I'll recommend that you suck on a piece of ice. There are some persons who, for example, I can tell you, me personally, although I'm a physician, I love my lemongrass tea, you know, and so if psychologically drinking a glass of lemongrass tea makes me feel better, then I'll continue doing that. It doesn't necessarily mean that I'm going to ignore the scientific evidence, and if something more serious happens, then I will not tap into what the health professionals are saying. And so persons can use their home remedy, but you still need to stay informed and follow the scientific guidelines.
I want to add that there's sometimes a role for these cultural and local practices, because I think I read an article of a Jamaican who lives in New York City who was diagnosed with COVID-19, and he highlighted what he did. He stayed, I think he was also a healthcare worker, and he remained at home, and he utilized turmeric, garlic, and I think it was ginger, and he said he recovered. Now, that's anecdotal. You can't say that that's going to work for everybody who would be diagnosed with COVID-19. And so I don't want to say no to these cultural and local practices, because let me admit, I usually have a little turmeric and ginger in my smoothie. So
No, the turmeric is a family from the same ginger. Isn't that we call it dye ginger? Okay, it has a sort of a reddish looking kind of.
It has a lot of anti-inflammatory properties, I'm told.
Right.
Yeah.
Now there are some people who are saying, look, this virus does not live and cannot survive in very hot climates. Like ours, in fact, somebody sent me something this morning and said, I don't know why the government is prohibiting us from going to the beach, because we understand that this virus cannot live in the heat and so on. Is there any truth to it?
All right, so when you look at the literature, there isn't consensus as yet. However, generally coronaviruses survive for shorter periods. In other words, they are less viable at higher temperatures and higher humidity than in cooler and drier environments. However, we don't have direct specific data with respect to this COVID-19 or SARS-CoV-2 as yet. Nor do we have direct data for a temperature-based cut point for inactivation. All right, so the necessary temperature would also be based on the materials of the surface and the environments, etc.
But I believe when the history of this virus is written, we will see, for example, whether or not, on average, persons like us in a hot climate with humidity, whether we did much better than persons in a colder climate. And so the history is still being written. And so we just have to wait and see. But for now, we appear to be faring quite well, but we have all the necessary preparedness plans in place for the worst case scenario. And I'm happy to say that we are doing well so far.
Now, what are some, before we leave, misconceptions that you would like to clear up in terms of this COVID-19? Because there's quite a lot of misconceptions out there in terms of the COVID-19 pandemic.
Okay, for me, of late, we received, or we have learned that the virus remains viable, suspended in air particles for as long as 3 hours. And based on that, we've made a recommendation that individuals should wear a mask when coming out into public space. However, I want everybody to remember that the best defense against this virus is still hand hygiene. So the wearing of the mask is not the fullness of it. You really need to remember to wash your hands. Keep your hands clean, keep your hands away from your face, nose, and mouth. Wearing the mask alone is not going to protect you totally from contracting this virus.
Actually, one misconception I want to clear, and that's affecting persons in the US right now, and I don't want it to affect us here, is that number one, it doesn't affect blacks as much, and two, that it doesn't affect hot climates. And because of that, if you look at the figures now in New York, etc., some of those big cities, the persons who are really dying, the majority of them are black persons. And
70%.
yes, and the Caribbean region is predominantly black. Yes, we have hot climate, but the most important thing is for us to maintain the social distancing and to do everything that is possible to keep this virus at bay. And so we can't make any determination now to say that we are immune or because of the temperature we will be immune. We need to make sure that we put everything in place. And as I said, when the history is written, we can look back a year from now and say, well, yes, this was so. But for now, we need to take care of all the precautions that she mentioned about hand washing, maintaining our social distance, etc.
I also want to add that COVID-19 also impacts younger individuals. And so it's not just the older individuals, 60, 70, and 80 years old, that are impacted by this virus, and younger persons also. You need to realize that you are at risk, and you need to, boost your own immune system, because you too can be impacted. So that's another, misconception.
There is one of the misconceptions that I want to clear up here also, because we hear the term all the time, all hands on deck. And a lot of people misunderstand what all hands on deck mean, because all hands on deck doesn't necessarily mean all hands on the steering wheel, okay? Because we need to have somebody who is leading, yes. But we still need the help of everyone on board. For example, the CMO is the head of our team, and she's the one who is leading, and I'm happy for her leadership. But we can't be fighting for the leadership role, and so sometimes we need to make sure that we don't have that misconception that when we say we are enlisting the help of everyone, it means that we are taking directions from everyone. We take all of the advice into consideration, because sometimes persons will send me a WhatsApp or a message and say, oh, I told you all to do this and I haven't seen you all do it as yet. We take everything into consideration and we chart the best course forward to get us through this turbulent time.
All hands on deck also means that individuals come Wednesday, Thursday, and you are allowed out to get your groceries and your essential services. Each one of us have a responsibility to adhere to the social distancing measures. So all hands on deck means each individual has their own personal and social responsibility to maintain a distance between others and not go into crowded spaces. So if you see a crowded space, you need to make a personal decision and leave. Yeah, and so that's what all hands on deck really means.
We all are in it together.
Yes.
Mm-hmm. Anything else you would like to say? Dr. Laws, Dr. Wilkinson? Any sort of advice you would like to further give to the public? I know that there has been a lot of advice and recommendations and so on proffered.
Well, we've said quite a lot. What I want to do is to personally thank you for what you've been doing in terms of getting this message out, because ever so often there's so many persons who call me and tell me that they're happy for the way you break things down and explain things to person. And we've been doing this explanation and public knowledge in a stepwise, systematic manner. And I just want to congratulate you for the great job that you're doing, and I hope that CNN doesn't see you and steal you from us.
Go ahead.
Well, thank you so much. And sometimes people say, but you're out, but I have my social distance. There's more than 6 feet between Dr. Laws and myself and Dr. Wilkinson. So we are maintaining the protocols that should be maintained. Dr. Laws.
Yes, I also want to thank you for facilitating this series of interviews. And to the listening public, I want to just say #stay safe at home.
Stay safe. Dr. Wilkinson, Medical Chief of Staff at JNF, I have come, I have seen what you have here. Your preparedness, it was not just talk, but actually it is in place. And I think you are to be commended for the work that you are doing. And equally, Dr. Laws, you have become a household name in St. Kitts and Nevis. Chief Medical Officer, doing a fantastic job, extraordinary. And we want to thank all of our frontline workers, our nurses and our doctors and all who work in the healthcare system. And everybody on the whole, the police and so on. and all of us who have a social responsibility, as social and moral responsibility, as Dr. Wilkinson keeps highlighting. Thank you so much.
Thank you.